Hi, I'm Whitney Morgan, Hashimoto's coach, creator of the Thyroid Reboot Method, and co-founder of the Functional Health Alliance. In today's video, I want to talk about one of the tests that I use in my practice with most of my clients, the Dutch test. And Dutch stands for Dried Urine Test for Comprehensive Hormones, and it provides an extensive profile of sex and adrenal hormones along with their metabolites. The Dutch is a pretty complex functional lab, so I'm not going to get into the weeds on it. Rather, I just want to highlight some of my favorite things about the Dutch. First, let's talk about who should run a Dutch. There's a long list of symptoms that can be red flags for hormone imbalance and adrenal dysfunction. Having one of these symptoms might not mean very much, but if you find that you have a cluster of these symptoms, you may want to run something like the Dutch. So what are the symptoms? Fatigue, sleep issues, mood swings, weight gain, low libido, menopausal and PMS symptoms that impact your quality of life, depression, irritability, brain fog, a sense of being wired but tired, anxiety, heart palpitations, flushing of the skin and other skin issues, any autoimmune disease diagnosis, and having a tendency to get sick a lot. If you're mentally saying yes to 4 or more of these symptoms, I recommend getting a thorough assessment of your sex hormone balance and adrenal function. And one of the best labs to do that is the Dutch. Urine isn't the only way to assess adrenal function and sex hormone balance. 2 other common forms of testing are saliva and serum, but they do have some drawbacks. When you run a saliva test, you're missing some critical data. First, saliva doesn't provide information regarding the metabolites of the various hormones that you're measuring. In addition to that, it only assesses free cortisol, meaning the cortisol that's circulating in the bloodstream and the tissues, but it doesn't measure total cortisol, which tells you what your adrenals are capable of producing. And it's pretty common for total cortisol and free cortisol to tell 2 completely different stories about adrenal function. One of the main drawbacks of serum testing is that it represents a brief snapshot in time. And when it comes to looking at cortisol, it's really important to see what your pattern is throughout the day. And serum only gives you one measurement for that specific time during the day. So you're missing all of the information that we could glean from assessing your daily pattern of cortisol. And just like with saliva testing, serum testing also lacks information about your hormone metabolites. While the Dutch is a dried urine test, some practitioners use a 24-hour urine collection method. Unfortunately, there can be some patient error with this type of collection method. And also, 24-hour urine collection doesn't identify any dysfunctions in the diurnal cortisol pattern. I want to be clear, though, there is no perfect test for sex hormones or adrenal function. But having said that, the Dutch test provides much more data than these other testing options. All right, now it's time to talk about some of my favorite things about this test. First is we get both metabolized and free cortisol. Metabolized cortisol tells us what the adrenals are capable of producing. Free cortisol tells us what's actually circulating and bioavailable. And like I said before, they don't always tell us the same story. One of the reasons this is important is because when these 2 markers tell us different stories, that can provide a lot of insight into thyroid function. And then finally, not knowing what your metabolized cortisol is can lead to your clinician making some false assumptions and then ultimately making errors in supplementation recommendations. Now for my second favorite thing. The Dutch shows us both phase 1 and phase 2 estrogen metabolization. And this is important because how your body deals with estrogen can impact your cancer risk. Also, knowing phase 1 and phase 2 can provide some insight into liver function, possible genetic mutations, and methylation issues. And finally, this level of detail often allows us to uncover some possible root causes for things like vaginal dryness, endometriosis, uterine fibroids, and ovarian cysts. My third favorite thing about the Dutch is we get to see the androgen metabolites. This information provides insight into inflammatory issues like food sensitivities, gut pathogens, and even excess toxic burden. It also helps us identify if there's any aromatization of testosterone occurring. Aromatization is when testosterone is converted into estrogen. Knowing the androgen metabolites is also very helpful when we're dealing with issues like PCOS, hair loss, irritability, impaired libido, acne, and a variety of different androgenic symptoms in women. And finally, my fourth favorite thing. The Dutch also includes several different organic acid markers. There's a lot we can learn from organic acids, but just to give you a short list, organic acids provide insight into methylation issues, melatonin levels, deficiencies of certain nutrients like glutathione and B vitamins. It also gives us neurotransmitter information and measures oxidative stress levels in the body. And come July of 2022, Precision Analytical, which is the lab that created the Dutch test, will be adding additional organic acid markers designed to tell us some things about neuroinflammation, biotin deficiency, and digestive function. I want to mention a few other benefits of running a Dutch test. The Dutch allows for a more effective monitoring of hormone replacement therapy regimens. It provides insight into gut and liver function, and it helps us identify diet and lifestyle strategies to aid in hormone balancing. All right, I hope you've liked learning a little bit about the Dutch test. If you have any questions, feel free to drop them in the comments. You can also reach out to me on Facebook, LinkedIn, or Instagram. In all three places, my handle is Whitney Morgan Nutrition. Thanks for watching, everybody. I'll see you next time. Bye.